Cool. So now quickly move to the next agenda, and that is to actually move to the first panelist session, like I said, for the 2020 edition of the Moses Conference. And we're going to be talking about, health tech in Nigeria. We all know that tech is like the new oil in Nigeria. Well, aside onions, I've been a habit. So we have, we have a great market for health tech in Nigeria. And so we're going to be looking at, for the panelist session, we're going to be looking at health tech in Nigeria, the challenges, prospects, and regulatory environment. And to anchor the session, yes, so we'll be expecting Sister Maria Bello, who's going to be the one moderating the panel session for health tech.
Assalamu alaikum warahmatullahi wabarakatuh. Okay. Naam, alhamdulillah, rabbil alameen. For today's session, we pray Allah make everything we'll be discussing today an easy one for us, and we pray makes the whole conference a successful one. Amen. Now, so here we are today, 14th of November 2020, our MOSDEV annual conference 2.0 is here live on YouTube. And here we have our panelists. We have one of our panelists on ground by name Dr. Lawal Bakari. Dr. Lawal Bakari, welcome.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. How is everything over there?
Everything is really cold.
Oh, okay. Alhamdulillah. Thank you so much for joining us today on this panel session. So we'll be expecting Dr. Olatokunbo Otitoju. So I'm sure he's going to join us soon, inshallah. So to begin with, we'll be discussing the health tech in Nigeria. And just a brief introduction of our panelists. We have Dr. Lawal Bakari. Dr. Lawal Bakari is the founder and CEO of EPID Alert. The EPID Alert Clinic is a global health security and awareness platform that provides Ebola response experience to prevention, detection, and response of infectious diseases like malaria. It uses appropriate technologies to implement models that are capable of strengthening the narrative for the impact of health promotions, health communication, and marketing practices on health outcomes of developing countries through design, research, lean execution, and capacity building. Welcome once again, Dr. Lawal Bakari.
Thank you for having me. Thank you for having me, and thanks for putting together this very important conversation.
Okay, thank you very much for that. So we all know, health situations in Nigeria, the health sector and everything. So that is why we have put up this panel session for you to help us do justice to some rising questions in health sector. And for this session, we'll basically be discussing about the use of health tech, that is, how we can use technology practices in our health sector. So I hope you'll be able to do justice to our questions and, have our audience go on with your, go home sharing from your wealth of experience. So to start with, please, I'd like you to give us just a general introduction of what health tech is all about, stating facts around its market size and potential for scale, using Nigeria as case study.
Okay, thank you very much. Once again, thanks for putting this together. I hope you can hear me well. Let me start from there.
Yes, loud and clear.
Very good. Thank you very much. In terms of the subject, technology and healthcare and how they work together, depending on where we are looking in the entire technology curve, Nigeria has been participating, even if it is just as consumer, in the whole technology and healthcare space for, of course, over a decade, over 2 decades, over 3 decades. What we might say is that some of what we term digital, were not internet-based services. Some of them, when we started digitalizing some of our medical diagnostics tools, especially the chemical laboratory and some of the microbiological laboratory services, and even some of our typical medical indicators or parameters measurement. So you probably might have heard of digital BP measurement tool, all those small that you use and then it read numbers.
Yes.
We played a lot of role as consumers of some of those solutions, maybe not the cutting edge part of them. And I'm also aware that we also try to be part of the technology development itself. So if you go to a typical school of electrical electronics, you will find guys who might be playing in a corner of biomedical engineering. In fact, one of my dad's close friends was a biomedical engineer. He studied in Liverpool and he worked in Luz till he retired. And these were guys who were responsible for some of the, or most of the digital devices that we're using in the teaching hospital and the College of Medicine. They were the ones fixing it. And some of these guys are even still in some schools of engineering in Nigeria till today. I think most of them are in the Southeast. And the truth is, most of our schools of electrical electronics engineering, they actually have the capacity to build some of those solutions, because most of them are just based on basics of parameters, maybe using colors, maybe using heat, which you can use your sensors to pick and then develop digital reading and numbers around that. So those have been in play for a while. But then recently, we now start to pivot into use of computer technology deliberately. 1989, IFE, University of Ife, that's OAU now, started what we call the Made in Nigeria Public Health Information System, which was back then, one of the leading use of the modern technology, computer technology now, which is IT and data for health purpose. And when we say health technology, we might always think it in terms of medical records, medical information, or hospital information. But definitely, as this conversation goes on, we will discover that this scope is a lot
beyond that.
So
encompasses more.
Of course, we shouldn't box ourselves in that space. However, that space is also one of the biggest. So right now, IFE started in 1989. The project never scaled out of IFE. Which may now bring us to what is the true scope of the market. Right now, I don't think we've even done any proper market calibration of what it might be, because that would be a lie if I tell you that's true, because it's part of what I hope we can drop on this conversation to say that, look, this is a market that is potentially very vibrant, but in terms of participation and influences of the tech ecosystem broadly, it's been really slow. And The reason it's slow is first because I was just discussing one of my senior colleagues in University of Lagos this morning. He's one of the lecturers there, that this is a market that is potentially big, but the ecosystem around it, that is healthcare now, the ecosystem is not as vibrant as probably you will find in like entertainment. So the Nigerian entertainment industry, for instance, is quite vibrant. You can see from the artists to the distributors to the networks, everybody's playing quite active role. Every morning you are hearing a new record is coming out. For healthcare, it's really slow. So we won't be able to start talking about this is the actual size of the market. However, every Nigerian is a consumer of healthcare. Healthcare, unlike luxury good, even unlike entertainment. I'm sure a lot of people on this conversation, they don't listen to music. They don't participate in one or some of what we call entertainment sector today. Yeah. However, healthcare, everybody needs it. That is actually the market. It is actually it's a public good. Healthcare is a public good. It means everybody also is, there's what we call public and merit good. Public is what everybody needs. Merit is what everybody needs at a very, very high quality. So healthcare is a public and merit good, which means every Nigerian deserves to have quality healthcare. That is from the consumer side, that is the beginning of how we should think of it. And in every population.
Okay, Dr. Lawal, please, I'd love you to go on, but then time is fast spent and we have more questions to cover up. Thank you so much for that general introduction. And as we say in Nigeria, when we want to try to, familiarize ourselves with some people, we say we want to farm some people. So you mentioned UNILAG, and I'm proud to say I'm an alumnus of UNILAG as well.
That's very good.
So yeah, so I think while we were on that, Dr. Olatokunbo Otitoju joined the call. He joined the session rather. Dr. Olatokunbo Otitoju, are you here with us? Okay.
Yes, I'm with you. Can you hear me?
Yes, loud and clear. I can hear you. Assalamu alaikum. Welcome to MUSDEV Annual Conference 2.0. Just a brief introduction about you. Dr. Olatokunbo Otitoju is a medical doctor with keen interest in healthcare delivery and financing. He is the group head customer benefits and claims management at AXA Mansard Health. He has worked on making healthcare affordable and accessible to Nigerians via private and social forms of health insurance, leveraging technology to improve service delivery. He has artificial intelligence certificate in healthcare at the MIT Sloan School of Management. Welcome, Dr. Olatokunbo Otitoju.
Thank you very much. How are you today?
Fine, thank you. And you? How's everything over there?
Fine, thank you very much.
Yeah, good to hear. So we welcome you once again to this session, and we'll be glad to share with you from your wealth of experience. So while you joined in, Dr. Lawal Bakare was giving us a general introduction on healthcare using Nigeria as a case study. So just in 1 minute, can you just as well give us a general introduction on health tech?
Yeah, so health tech is the adoption of technology in the process of delivering healthcare. Compared to the orthodox methods of delivering healthcare services. So health tech has grown in Nigeria over the years in different aspects. Electronic management of records, telemedicine, health information systems, online pharmacy systems, health search, health trainings, diagnosis, genomics, and several other areas where technology can be used to deliver healthcare services. So Nigeria, as we know, technology is, you look at Nigeria critically, you look at a low-income country, you look at a country with a very large population, you look at poverty as well, you know that something must give. We have to find ways of solving our problems. If you have a population as large as Nigeria and then we have low income, then we have to find smarter ways of doing things. If we do not, and we want to approach this issue in the conventional way, we'll will fail at it. So technology is the only way to drive this kind of success that we need in the healthcare space. And the earlier Nigeria realizes it, the better for us.
Thank you very much for that. Thank you so much for that general introduction. So back to you, Dr. Lawal Bakari. I have a question for you. Though I know you mentioned something about online medical appointments and all of that earlier, but could you like shed more light on that? Like these areas, like booking appointments online, telemedicine, web-assisted diagnosis, and so on. Do you think there are areas that can they have opportunities in Nigeria? Do you think there are areas with opportunities in Nigeria?
Yeah, thank you very much. I'm happy that we have a health insurance person in the conversation. So it helps to put perspective into some of these things. So everything depends on the economics. First is, yes, in terms of population size and potential markets, yes, the potential market is there. But the question is, like most of us on this call, there have been instances where you have a headache and then you call your doctor friend, Dr. Bakari, please, I'm having a headache. What should I do? What should I use? Most of us got used to this, our home economics and home support system, where whenever we are ill, we are always quick to call a friend or for a people. That is purely use of what the telemedicine, advanced telemedicine service looks like. But what we've been doing for a long time is who pays for that transaction? Who even do we even reflect on the economics of it? So in terms of market opportunity, yes, it is there. Even looking for me, the way I look at it, it usually relies on our internet penetration and our mobile telecommunication penetration. The farther that goes, the more consumers get used to using some of these technologies, the more the market systems develop solutions that healthcare can learn from. So for instance, look at the way Uber does ability to bring people to you, and then in terms of business ecosystem and insight, we see that there's opportunity. So yes, the opportunity is there. The market is potentially also there. We've experimented. I wouldn't say we've used that skill. We've experimented with some of them. So if you check some of the local databases or guys that are running these, they may have some tens of thousands of people or less in the platforms. But of course, we have not really delved into it, because till our primary healthcare system, which is meant to deliver care to most of Nigerians, is leveraging these platforms, we will not be meeting our healthcare needs, our true healthcare aspirations.
Yeah. Thank you very much for that. Dr. Olatokunbo Otitoju, please, can you share with us your experience with any of these local apps or local applications rather, or health tech offerings? Can you just share any experience whatsoever you have had, maybe recently or in the past?
The experience has been great. It's not, to be honest, it's not rocket science. It's not as if we are trying to bring something from Mars or something from Pluto or another planet that we are not sure. It's simple things that we've seen in other industries, like the fintech industry, like other tech industries. It's just a simple way. I want to talk to a doctor. Can I do it via my mobile app? And yeah, we've seen it grow. There are so many telemedicine companies in Nigeria that are doing fantastically well. Even though adoption may be very, very slow, it doesn't still mean that their solution is not practicable. And then I know some EMR companies that are in the country as well, related with some online pharmacies. We use them to deliver drugs to our patients without having to necessarily go to the pharmacy to queue and ask for drugs. So, and this COVID-19 pandemic really helped them to scale as well, because I know several pharmacies that have ordered drugs for, and they have delivered across the country. Tech companies as well, telemedicine companies. I know some EMR companies like Helium Health, that is pushing the wave in the health information system. So it's not something it's not magic. It's simple. All we need is just to continue to grow the industry and put a proper regulatory and legal framework on ground, so that investors can have confidence in the industry and they can bring in their money to invest in the sector.
Yeah, thank you very much for that. I think the medical appointment will really go a long way in reducing queues we have in our primary health centers. Because in the past, I've had an experience with a private hospital, though. They have this website where you can go online and book your medical appointments. You see the days you have available doctors. So you even see the time, and you have contacts there of who you could talk to in terms of, oh, okay, because you have maybe orthopedic, I don't know, you have orthopedic and I think physiotherapy. So for a patient, you might be thinking that, oh, maybe I need to see a physiotherapy. But once you put a call through, and probably you talk to someone and then you tell them, okay, this is my issue, this is how I'm feeling and all that. They could easily point you to another, or direct you to another maybe doctor or something, that, okay, no, this is not who you're supposed to see. You're supposed to see this person and all of that. So I think is a good one. I think we are growing. Basically, I think we are growing. So Dr. Tokunbo Otitoju.
Yes.
So what's your opinion on challenges you have had to face in the health sector in terms of monetization, innovation, cost of setup, equality investment as against grants when it comes to like growing? Have you like had any challenges in the past?
The challenges, like I said earlier, it has to do with scalability of the business. Investors want their money back. We should also not forget that health as well is more of a social good. People have to live a good life. But investors, when they bring in their money, they have to be sure that they're going to get the money back. If there's no proper regulatory framework on ground, it will be difficult for anyone to bring in money to invest in that kind of sector. Because as it is today now, we don't even know what the government will do with telemedicine. Probably a minister can come and say, oh, this thing we're not supposed to do it this way. All telemedicine companies, go and register as this, go and put up one office in this place, go and put up an office in 6 geographical locations in Nigeria, go and do this and go and do that. Oh no, you can't hire a doctor over the phone. You can't talk to a doctor over. If those things are not clearly spelled out, then it will be difficult for anybody to. Right now, it's a free for all. There is no regulation. The market is just there. So in that, people will be
like open-ended.
Skeptical. Yeah, it's open-ended. So now, yesterday, 2 days ago, the president signed the Banking and Other Financial Institution Act again to regulate banks and fintech industry. That's the kind of thing that pushes that industry forward. You can see how many digital banks we have now. You can open an account in almost 2 minutes. You can even get a loan in 1 minute. If I want a loan now, before the end of this call, this 1 minute, I'll get a loan. I'll get the money in my bank without even visiting any bank. I can pay. I can carry out transactions. I can open an account.
Yes, sure.
So that's the kind of thing that drives investors into the space. Then the cost of setup depends on what the individual wants to do. The cost of setup can be very, very huge as well. But I know Nigeria now has good developers that can write programs, write codes, and build applications, and ERPs that can function effectively. So we don't have to outsource so much of this skill and talent. In fact, Nigerian developers are almost as good as their international counterparts now. So cost of setup may be huge. It depends on what the individual is starting with. The basic thing we need to push now is regulation and adoption. Once regulation comes in and the market is properly regulated, more people will adopt technology. There is no way out of it. Nigerian doctors are leaving the country. We still have a very high population growth, one of the highest in the region, in Africa, and in the world in general. Our medical colleges are not expanding, which means that we have, right now, I think we have about maybe 30 or 35 medical colleges in Nigeria, and they can only produce about 3,000 or 3,500 doctors per annum, and we have a gap of about 60,000 doctors. So There's no magic that we can perform using the traditional way. If we need to start producing doctors now, it will take us 20 years to fill the gap. If we decide to go the orthodox route, except we want to import doctors from India or from other places to fill the gap quickly. But our population is growing, so if we cannot do that, then we need to adopt technology to reach people. Internet penetration is at 80% in Nigeria. Almost everybody in Nigeria has a mobile phone, even if it's not a smartphone. We can find other ways of using ordinary phones to talk to people. We don't need, all we need to do is to save lives. Saving life doesn't have to be by using the highest form of technology or the highest equipment in the land. You just want to save someone's life. It's as simple as calling the person on the phone and saying, lie down on your the left side of your body, or take this drug or take this water, and the person is fine. You don't need to bring in the best professor or anything. There are systems in Kenya where, you know, midwives and gynecologists talk to pregnant women over the phone, and it has reduced their mortality rate significantly. Nice. So that's what we need in Nigeria. If I know that there are 10 pregnant women in a remote village in Kogi State, and all I need to do is just to call them to ask some questions, and if there are problems, I can easily send in the ambulance to pick them. I think that's better than leaving them stranded without any form of intervention at all. So why can't we just adopt those simple technologies? Just a phone call to 10 women. I can monitor them from my room in Lagos, because there are no doctors in some parts of Kogi State. I can do that from Lagos. I'll call them every morning. How are you doing? Can you feel the baby kicking? Do you have fever? Do you have this and that? And the woman says, oh, I'm fine. And I'll tell her, okay, go for your scan on so date. When you get back, find someone who can read English and read out whatever is on the scan to me. If you cannot look for a camera phone, snap and send to me wherever, if that's available in your village, and I can do that, and some of them will be fine for it.
Yes,
but isn't that better than leaving them stranded without anything? You know,
I agree with you on that, and I think some of our government officials hopefully are watching this, and I feel I look forward to that time where we would have this. I'm sure most of us must have watched this popular Three Idiots. That part where the woman wanted to give birth and the doctor, which is the sister, was not available. So she was able to like direct them on what to do, getting the vacuum and all of that. So I think it's part of what Dr. Otitoju just mentioned now about putting a call through to pregnant women and trying to, you know, ask them about the about whatever condition or state they are generally. So I think that's a good one, and I hope government is are going to do something about it in the nearest future. So back to Dr. Lawal Bakare. However, before I put out my question to you, I would like to tell our audience that you can always throw in your questions, and I'm sure our panelists here will do justice to that. So Dr. Lawal Bakare, Dr. Otitoju mentioned something earlier about regulatory bodies. He said something about being open-ended and all of that. So my question to you will be that we all know healthcare practice is regulated by professional bodies and government to avoid quackery. Of course, though, we know that cannot be curbed up 100%. We know there are still some quack doctors who give wrong prescriptions, wrong diagnoses, and all of that. But are health tech companies covered in their activities as well, or are they self-regulated? Like they are not under anybody; they are just independent.
No, they are not. They are also regulated. The only thing is that the way the regulation is currently structured is probably not as organized as you will find probably in the banking sector, because the banking sector took a deliberate transition to digitization, and then had to put their own regulations. Even the insurance sector also probably has something close. In healthcare, it is you have MDCN looking at the physician and what the physician is doing, but you still have the nurses and the pharmacists. They also have their own councils that are looking at what the professionals are doing. In terms of the work that they do, there is the health information. I think it's called the Health Information Organization of Nigeria. I've forgotten their name, but there's also another regulatory body that is responsible for managing of medical records. I think it's called Medical Records Council of Nigeria. Yes, they handle the medical records. So they assume the role of who collects information in the hospital, who manages it, who stores it, and who transfers it, because they were the ones that were managing the medical records rooms, which were where we used to file the forms. But now that things are going digital, their regulation still talks about who collects information, but we always wonder if that can still stand. Right now, a doctor can sit in his office, enter the records, and transmit the information. How does that affect what they do? But outside the healthcare office itself, we also have regulations by the likes of NITDA that is trying to control the broad information architecture of the country, especially looking at data protection, among other things. Because it is healthcare, there are global regulations, there are also local regulations. In terms of information generally, you've heard of the likes of GDPR and co, which still also talks about information regulation. So there is all of the broad body of regulation on information itself, which we need to listen to, so we can put that in the hands of NITDA. So in Nigeria, if you want to do any health tech related, especially when you have to collect patient's record or patient information, there's the body of Nigeria regulation around the health information of the patient belongs to the patient, etc., etc. That is covered in the National Health Act, which is also part of the regulation. In terms of identity, we have NIMSI, which is the identity management. So the NIMSI also has a role to play, which is, at the end of the day, the way I look at the role of the likes of NIMSI is there's still the bigger NITDA, which controls, okay, this is going on with identity. Let me see, there's also some types of data that are very simple, but you won't probably understand. Things like passport number and things that are related to travel and related, that one also has to do with the immigration service, who have the role of collecting every information that's related to travel and those kind of things. Then you still have information around broad concept of communication, which you can find in the Communication Commission. So as it is, where I'm going to is, what we don't have in healthcare is a simple regulatory framework that is housed under probably one single block. We can call some of the components from different places, but put it in a simple way, so that whoever is a practitioner, that is the technology guy, or the owner of the health facility who wants to run the business, or even the patient, can rally around it. As a patient right now, you don't know how your information is handled. And if your information is wrongly handled, what do you think is wrong? You don't probably, even the doctor will just tell you, the patient information belongs to the patient. And probably the patient can go to a hospital and say, look, I want to call my data out of your health information system. Right now, where do we tell the patient to go and read such information? You understand?
Yeah.
I mean, that's what my understanding of the current regulatory framework is. If you look at it, there are like 20 or 25 regulatory institutions and platforms that people have to piece together to form what we mean by health regulation of Nigeria, in terms of health information regulation of Nigeria. My own perception would be that over the years, guys that are in the business of technology policy, which is a very boring area of technology, needs to participate in. The Health Act of Nigeria requires that we begin to standardize most of what we do. That the 2014 Health Act. My own interpretation of that is, for the health information component of our broad health regulation, we need guys who are into policy. This is not coding, right? This is not coding. This is purely a boring area, but it's also very important for technology to stay. And of course, it might need an interaction with guys who are the practitioners. It might need an interaction with the legislators. It might need interaction with the patients.
I would need to stop you right there because of time, and we have some questions, of course, from our audience. So I'm sure from the questions you would be able to even like throw more light into some things. Dr. Malato Kumbo Titoju, do you think telemedicine, do you think it will be an acceptable area in Nigeria? Like, in the nearest future? What do you think about it?
Of course it is. There is no option. I told you already that there is no option. We can't produce enough doctors. We cannot build enough medical schools. We cannot train enough consultants to cover the gap. Nigeria is a country of 200 million people, and we have less than 35,000 active medical practitioners in Nigeria. What magic are you going to do? And most of them are concentrated in Lagos and Abuja. Lagos, Abuja, and Port Harcourt. How will you reach the person in Jalingo? What do you want to do? You want to send me a doctor in Lagos to Jalingo to go and practice? Do you think I will pick that call? No. It's not a clarion call now. I did my NYC as the only clarion call. Do you think I'll go to
Potiscom
to go and see doctors? Go and see patients? No. But give me a phone and a mobile app. I can help you out with that.
Okay, so you mentioned something earlier.
Okay.
Go ahead.
I'd like to add to that. So there was this report that was published in 2007 by the International Finance Corporation. They were looking at the business of healthcare across Africa and the opportunities. What Dr. Otuteju mentioned is a challenge, but it's also in itself an opportunity space. So for instance, in the organization, we started this initiative on HRH, which is a human resource in health, trying to look at how we can augment some of the missing capacity. So if you look at it, there are certain things that we can use telemedicine to do. There are certain things that you still actually need that doctor, especially things like surgery. If you say you want to do robotic surgery is expensive right now. It's not something we can think of. So
that's another thing.
Those of you who've learned of the work like the likes of Coursera have done, and now Coursera is now closing gaps in learning. So e-learning in healthcare is still another opportunity to look at, okay, what capacity, how can we scale that doctors, nurses, pharmacists gap that we have? So there's an opportunity, again, use of technology in that area.
Thank you for that, Dr. Lawal. And Dr. Tokunbo mentioned something earlier that you don't necessarily, or patients don't necessarily have to have maybe a smartphone or something. They can just call and all. So my question to you, Dr. Lawal, is that considering that, of course, not everybody is tech savvy, not everybody can handle smartphones. Even people who use smartphones, theirs is just, okay, let me just call. And most of the times, our mothers, our parents, it's just, okay, my child gave me this phone, let me just call. It's not like, and what they do with it is maybe post Facebook stuff and all of that. So they are not really into the, I want to handle applications and all of that. So if we are talking about health tech and we're talking about telemedicine, web-assisted diagnosis and all of that, we want everything to be digitalized. We want everything like that. So how do you think people in remote areas, not even only remote areas, of course, remote areas is there, the network factor, how do you think they would be able to, how can we reconcile this in the health tech?
I think I understand your question very well. So what you're talking, so in healthcare, we usually talk of concept of access. And so you can talk of access in terms of, I can't access the technology, right? Oh, I can't afford it. But there's also the access of building a hospital without a ramp and everything is staircase. And then someone who is disabled cannot use it. So that is also a challenge of access. Now, what we are looking at here is for those who are in remote communities or who are off the grid or those who don't have the literacy to use these technologies, there are different opportunities in terms of innovation and design to deal with some of these things. I'm sure those of the tech guys on this call, they are used to what they call user experience design, UX design.
Yes.
You are so much into all of that right now. And I'm really happy the way ecosystem is going around the whole consumer experience and all of that narrative. As a technology developer, if you reflect deeply on a user experience and a user journey, there's nothing that says that my grandma cannot use a smartphone if the UX is done really right. So that is a challenge for the ecosystem. It's not about the technology, it's about who is developing it. It's not about the consumer rather. Who's developing it? Or are you factoring how these people utilize these technologies? However, my own wife actually started a project recently around taking healthcare to the doorsteps of people, right? So there is also that process of enabling people, because my conversation back in the day used to be that in every of our 774 local government and about 7,000 plus words in Nigeria, there's at least one person who has a high school certificate who is looking for a job right now in Nigeria. And you can remember what Dr. Otito you said, some of what we do in medicine, they are not like rocket science. If I can provide basic education on just how to do medical history, which is just basic question and answer, I can send someone to most doorsteps. And so if you think in that direction, so there's also the option of use of agents, which the likes of Pagatech have done for fintech, which a lot of guys are doing with POS and withdrawal funds right now in places that we can't find the POS. So it's innovation and thinking, it's ability to meet the consumer where they are, because that's where the money is. If you follow the money, you meet the consumer where they are, and you probably might be able to exchange funds. The guys in health insurance, they will tell you that the informal market is really tough right now. How do they crack into the informal market? And this is also a way of cracking into the informal market. If you can guarantee direct interaction with patients continuously, and this patient can afford to pay a token over a period of time, health insurance may be able to provide a package for them. But that will still require somebody to reflect on the consumer journey. So it is not about the consumer, it's about technology, and those of us that are building it. The whole concept of UX is big. The whole concept of consumer experience is really, really important.
Great one there. So from the first thing you said, it is safe to say that no matter the technology, no matter what you do, there is always downside to everything. There is always a challenge. Just like you gave the maybe staircase and a physically challenged person and all of that. So no matter how we think that, oh, we want to make this thing easy for people and all of that, there will still be a little challenge when it comes to the use of technology. So for now, we will be having our questions and answers from our audience. So I hope you are ready for our questions. So here is coming from, this is coming from Sulaiman Lawal. So he said he would like to direct his question to Dr. Otitoju. Wow. So he actually specified. He knows what he wants. So how do you think the government can leverage technology in solving the perpetual problem of our national health insurance scheme? Dr. Olatokunbo, are you there? Can you hear me?
Hello?
Can you hear me?
What did you say?
Okay, so I have a question for me. I have a question for you, rather. So it's coming from Sulaiman Lawal, and he specified that he wants you to answer the question. So this is someone who knows what he wants. So he said that this question is coming from Sulaiman Lawal, and he's directing the question to you. Yeah, so he said that, how do you think the government can leverage technology in solving the perpetual problem of our national health insurance scheme?
The government can do a lot with technology, starting from distribution, distribution and payment system. Distribution is the major challenge for them, how to get NHIS to reach a lot of people. And the easiest ways for them to leverage on mobile technology, as many Nigerians that can afford to buy a phone, they can reach them via their mobile phone. You don't have to set up offices everywhere, trying to reach people on foot. You can leverage on mobile technology. Payment system is also a very important one for them. Today, you can buy airtime on your phone. Today, I can pay for DSTV on my phone. I can pay a lot of things on my phone. So why can't I pay for my health insurance on my phone? But for NHIS, probably you will have to go to their office with a teller and do all those kind of things. Those things they don't make people adopt any scheme. If I want to pay for my NHIS now, I have to go to their office in Ikeja or in Yaba, and then I'll get a teller, fill it, take it to the bank, pay the money there, and go back to the office again to tell them that I've paid, that they should put me up on their system. All those kind of things. They don't work again in this kind of environment. So they can leverage on technology for distribution and payment system. Payment is a challenge for them. Distribution is also a challenge. About 80 million Nigerians have mobile phones. try and reach them and tell them to pay 20 naira per day from their airtime and roll out a perfect scheme. You understand?
Yeah, I do. And I hope that answers Sulaiman Lawal's question. I hope Dr. Otitoju has been able to answer your question perfectly. So another question here from Ajibade Taufik Damileye. So Dr. Lawal, I'd like you to answer this question. He said that, is it ascertaining diagnosis about signs and symptoms?
Okay. Right.
Yeah. Then another a second question is, when speaking on the phone with a patient, won't it affect the diagnosis since the doctor won't be able to observe the signs?
Taufik, very good question. You know that in medicine, when you are talking about signs and symptoms, there are some diseases that you can reach your diagnosis. In medical, we say spot diagnosis. If you look at something, you know what it is. There are some that need you spot. Yes, there are some that need you to do palpation. There are some that need you to do auscultation, etc., etc. There are some that need you to do chemical investigation. There are some that require you to do, etc. The diagnostic landscape is very wide. But as a doctor, you can reach an initial inference, maybe from your medical history. If I'm talking to someone, the person has a swelling in his mouth. I'm a dentist. If a person has a swelling, I know what I can start thinking of. Then there might not be need for me to observe closer. Again, guys, these are the rooms for technology. This is the very, very huge room that technology has a play in mitigating some of these distance barriers that have been in this space. This space has been there for decades. Probably we are not looking in this direction. So point to make there is, yes, there are certain diagnoses, not all, that requires the presence of the physician. But there is also a very huge body of diagnosis that you can either do an initial physical interaction and then move the rest remote, because you know what is going on there. You move your follow-up to remote. So the way you can design this thing is very broad. I don't want us to go into discussing design because it will just take us all over the place. But what I know is to answer your question is a yes and no thing. It's not all diagnostics that require the presence of a healthcare worker. I don't want us to stick to the use of doctor, because there are instances where you can work with a paramedical person to be in the front line.
Okay.
The paramedical can be there, look at the patient, and relay the information to doctor. So you can therefore use 5 paramedics to stay with 50 people, and 1 doctor to support 5 paramedics. If you look at that model, what you are doing is a doctor is taking care of maybe 50 persons, and that might be real time. And so some of these things you can dump on AI. If you see A, B, C, D, AI can reflect 3 options, and you can say, okay, based on this, this is what it is. That reduces the time. It reduces your. Don't let us. The point is.
Yeah, sure.
There's so much you can do.
Okay, so we'll just be taking this last question so we can wrap up for this panel session. Time is fast spent. So I have one here from Kazim Adegbuyi, and I would like Dr. Lawal once again to answer this, and maybe Dr. Olatokunbo, if you have any additional comments to the question. So Kazim Adegbuyi says that, in what way will 5G network technology and IoT, that's Internet of Things, assist in our medical system?
Who should go first?
I don't know. Any one of you, I don't know.
Okay, let me try. So,
okay,
what is 5G? 5G is just very fast internet, right? Super fast internet.
Yeah. Yes.
So what that does is it just removes that how much can we transmit over the internet per time, and then in terms of Internet of Things is just basically embedding systems that can transmit internet, that can transmit data real time. That is what Internet of Things is all about. So this question is a conference. It's a conference title in itself. So I don't know where you want to.
Yeah.
So, but what I know is, some people have argued that Africa, we've not even consumed our 3G They've done 5G, 4G. We don't even know what 4G is. We are dumping 5G and we are chasing all of these technologies. What I feel is also, but that doesn't mean we are not going in the direction. So as not to misunderstand ourselves. What I think it is just in the speed of interaction between two ends and what we can transmit. So there are certain data, like for instance, let's use diagnostics, especially the radiographic diagnostics, where they take very huge images. Some of them are videos that need to be sent, and you can imagine sending a 5 gigabyte picture to a colleague across. Maybe 4G can do that right now, but imagine transmitting that real time, right? Imagine it's being transmitted real time, and they are able to have this high definition. So yes, there is a lot of room for it. It also supports things like robotics very, very well. And in terms of use of robotics, please don't let us think this medical system as just hospital. There's a lot going on in the space right now.
Wow.
So if you think of logistics and the need for us to transfer vaccines now, so you're talking of COVID vaccine, the process of delivering COVID vaccine for Africa is a problem for the whole world right now. So now that they know that there's a vaccine, how do we send it? How do we track what is being sent so that people don't steal it? The way they went to steal vaccine in Kogi, they think it's palliative. You know, the kind of things that what you want to protect against. So this is a big definitely this is a big subject, but definitely it has a lot of solutions to offer.
Okay. Thank you very much for that, Dr. Lawal. Dr. Otitoju, do you have any contribution or addition, anything you want to say to that?
He said everything all, like you are looking at 5G. Like, while not dismissing the importance of 5G and IoT, but we have places in Nigeria where you can't even get 2G network.
Yeah, true.
And people how many Nigerians can actually afford 5G internet and data, the cost of data that will come with it? So let's start from simple things. In Africa, we must learn how to crawl before we walk. We've not even scaled the simple issues in front of us, and they want to start running.
True.
And
I agree with
that
you.
And for all systems, it's like that. You know, from this 5G that we're talking about, we did not even fully adopt and develop our local CDMA, our landlines and our broadband system. We jumped straight from 0 to GSM. So that's why you find in most homes in Nigeria there are no CDMA or landlines. So we are not even done with laying optic fibers and all that. We are thinking of 5G. That's 4G optic fiber lines in Lagos. You don't even have it everywhere. Now we're talking about 5G. Let's pick up USSD and see what we can do with it. Look for what you can do with the 2G network that you have all over Nigeria.
Correct.
5G, it will take us the next 10 years to even roll out 5G across Nigeria. By that time, they will already be in 8G.
Wow.
So there's so much to talk about this subject. So I think it's a conference.
True. As you rightly said, it's a conference topic on its own, as you rightly said. And I think that answers Kazim Adebui's question. And so we'll be wrapping up this session. And it's so nice having both doctors here on this session to do justice to the health tech situation in Nigeria. Once again, we have Dr. Lawal Bakari on the session. He's the founder and CEO of Epid Alert Clinic. And we have Dr. Olatokunbo Otitoju. He's the Group Head Customer Benefit and Claims Management at AXA Mansard Health. I hope I got that correctly. So Any final word in 60 seconds? Any final word to our audience?
For those who are technology-based guys, I personally want them to please look closer at the ecosystem of healthcare. I'm personally available. If you have interest in this, you can hit me up on any platform. I'll be very willing to share because this is an area that I'm not just passionate about. I'm willing to put my own resources in it.
Nice one. Dr. Olatokunbo, any final word?
I want to say that people should not be discouraged. The potential for healthcare is there in Nigeria. I always tell people that no serious investor will disregard Africa at this point, and Nigeria. The market is saturated all over the world now in those developed countries. If you want to write a program or application now, in Canada, for example, you will see almost 20 or 30 different ones that have been done, and they are almost and waiting for adoption. So Nigeria is like a virgin land now that we can all come and develop. The earlier we do that, the better for us. There are lots and lots of opportunities in the health business. We need to push the government to do what is right. We need to push the lawmakers to amend the Nigeria Healthcare Act so that we can change our fortune in Nigeria.
Yeah.
Professors,
Thank you very much.
professors, training doctors and everything. It's not going to take us there. To be honest, we can't get there. We have
Thank
to
you
tell
very
them
much
the
for
truth.
that. Yeah,
Yes.
true. I agree with you. So you can continue to join us live on YouTube or join our live chat and tweet on Twitter using the hashtag MusDevConf20. Use the hashtag MusDevConf20. We hope some other time you would always join us willingly when we call upon you. We have come to the end of this session. Bye for now.
Bye.
Bye. Assalamu alaikum.
Alaikum salam.
Hello?
Yeah, that was an amazing session from Sister Mariam Bello and the two doctors. Was the session to keep continuing. I don't know what you think, Ryan. It was amazing.
Yeah, it was
talking
actually
about
exciting.
the prospect of health in Nigeria.
Yes.
Yeah, the prospect of health, and then I think important things stood out during the discussion, right? That first, whatever that needs to be automated would be automated. So away from the traditional setting of having to like stay long queues to visit doctors and the likes. So we are positioning or revolutionizing what we see as health in the future.
It's actually bringing something new to the health industry in Nigeria. It's when we were talking, I was intrigued and I wondered like, okay, let's see where this goes. I was even thinking in my head, I have medical friends, doctors who are my friends, and I'm like, guys, can't you guys venture into this stuff? It's amazing actually.
Yeah, but I think the next session, because it's important because you can have ideas and get the most important ideas in the world, right? But what changes everything is where innovation comes and money must follow, right? So I think that will lead us to our next session now, which is well to introduce because a lot of this has to push